when I interviewed at Beaumont Grosse Pointe, I was very impressed by how the residents got along with each other and the faculty. I really liked that it was a small program where it felt like the faculty got to know the residents really well, had the opportunity to teach really intimately with the residents, but also had the benefits of being in a large health system, the academics of a large health system, and the affiliation with a medical school.
One of the things that I was really attracted to was the fact that unlike a lot of other programs, the faculty has such diverse interests and things that they are doing in terms of family medicine. We've got faculty who are involved in LGBTQ care, HIV care, transgender care. We have faculty who love obstetrics and providing that to our patient population, which includes, lower socioeconomic classes and kind of finding unique ways to provide them prenatal care. We've got folks who enjoy, OMT and procedures and stuff like that, sports medicine. And so it was just so well-rounded that it didn't matter what direction family medicine took me in, I could have someone who I could lean on and get mentorship from. The aspect of having, a relatively small program, there's only 18 of us, we have a fairly small faculty as well, means that you spend a lot of times with these folks and you get to know them on a deeper level than you might with a bigger program or one where you're not spending as much one-on-one time with folks. So I didn't just get to know my co-residents in terms of being fantastic doctors, but I also know them as people and their values and their loves, and we got to connect on that level. And those are relationships that I'm gonna leave this program with.
The number one thing that I'm most grateful for is how much support you have on the attending level. You can text them anytime if you have a question about anything. Like I was texting Dr. McLaury last night at like 9:30 because I just couldn't figure something out, and he replied back to me within like 15 minutes. I have support on the senior levels. Anytime I had a question about medical words and just how to make notes sound more professional, they would be happy to tell me and guide me in the right direction. And even within my own residency class, everybody's looking to push each other up and hold each other up, and we all have bad days and we all have good days, and it's nice having those people to talk to and to vent when you do have a bad day, and to celebrate your little daily accomplishments.
One of the strengths, especially throughout intern year, was just the access to our subspecialists. Intern year, and this is true across a lot of intern years, but you're going to be in the hospital a lot. Our subspecialists in the hospital are fantastic. We have really good relationships with them, and a lot of them just hand us their cell phone numbers and we are able to text or call them, and I think it's just fantastic that they give us that availability into their lives, and they really enjoy teaching. I think that is one of the true benefits of this program, especially being in a small community hospital.
We really recruit from a lot of different socioeconomic backgrounds, from the east side of Detroit to Grosse Pointe, so we're seeing patients who are practically homeless to corporate CEOs, and so it's a really nice patient population to work with and also for our residents to learn from. I think that extends to our clinic space as well in the variety of patients that we get to see. The other thing I've really enjoyed is the amount of newborns we're able to see. We have a great amount of pediatrics in our clinic, and for people who like to work with kids, it's really a lot of fun. We have no trouble seeing newborns or having a volume of newborns coming into our clinic.
I had a continuity OB patient. It is the perfect family medicine story. I am the PCP to her and her husband. I look after her 3-year-old daughter, and I followed her throughout her entire pregnancy and then was able to deliver her earlier today. I think it's just a great example of how broad family medicine can be, how you can really care for the entire family unit as a whole. And it was just one of the most enriching, amazing experiences to kind of bring that whole relationship kind of to a bit of a finality in my last year of residency.
East Detroit gives us an opportunity to deal with a lot of different patient populations, including patients where we have to take into consideration a lot of different social determinants of health. A lot of people live really close to highways, so we see things like asthma in them that are more prevalent. Additionally, we have a lot of patients from the suburbs in St. Clair Shores and Grosse Pointe, so we get a wide variety of different types of patients in our program.
So one of the unique things about this program is the flexibility within the curriculum. There's a good base set there, but the program leadership is very open to residents creating their own new special interest track. For instance, over the past year, I've worked with our program director and assistant program director and some of our faculty on developing a sports medicine track and a point-of-care ultrasound track, because those are definitely something I'm really interested in and want to pursue, and they've been very open and supportive in helping me find avenues and other physicians to work with that have experience in that area.